It is our moral obligation to extend a helping hand to those who are struggling and provide them with the support they need to heal and thrive. Mobile crisis units are an essential resource akin to ambulances and firefighters in the battle for mental wellness. They serve as first responders to individuals in the throes of mental health crisis, offering a lifeline of compassion, care, and understanding. These dedicated professionals possess the expertise to navigate the intricate nuances of mental health challenges and provide immediate assistance when it matters most. By allocating $3 million in additional funding, we have the power to bolster the effectiveness of these mobile crisis units.
I need our council members to take this budget request seriously. We need to properly fund mobile crisis units. We need 24/7 access to mobile crisis units for all of our neighborhoods. We need to pay our mobile crisis workers living wages. This work is hard. And we need to reduce wait times for mobile crisis units. No one should have to wait more than 30 to 45 minutes for life-saving care and support. We need $3 million in additional funding so DBH IDS can make mobile crisis units thrive in Philly.
We demand treatment, not trauma. We want care and not cops.
Further, mental and behavioral health issues can impact any one of us. I want you to imagine, if it doesn't already, that this issue impacts you personally. Imagine that it's your child who's had a sudden and frightening break from reality. Imagine that it's your friend experiencing suicidal ideation. Imagine that it's your parent who's begun behaving erratically and unsafely after a scary diagnosis. Who do you want showing up at your door if you call for help?
Okay, just because you brandish a badge or wear the color blue does not mean that you have the authority to be violent towards someone that does not understand what is going on in the moment. You would not beat someone if they walked into the emergency room because they were vomiting. That's not a reason, it's sickness. And just because it's not physical, it's mental and we can't see it, that doesn't give the right for people to die or be harmed or incarcerated for that reason, because incarceration is not the answer either. You can't lock someone up and expect them to be rehabilitated in a prison. That's not the answer. We need preventative help. And $3 million, that's a drop in the bucket for this problem that we're talking about. The city of Philadelphia is in a state of emergency when it comes to mental health crisis. I am here this morning to ring the bell and sound the alarm. It must stop. The amount that we're asking for today is only the beginning. We need to be available 24/7 because mental health crisis does not know a clock. I'll leave it at that. And I'm almost 1.6 million people in the city of Philadelphia. We have 4 mobile response. So you do the math.
Each day, 200 Philadelphians call these hotlines seeking mental health care. In most cases, counselors are not able to provide the care and resources over the phone. But in some cases, crisis requires an in-person response. And that's where the mobile crisis units come in. One community mobile crisis response team consists of a peer support specialist, which is an individual with lived experience using crisis response services, a licensed mental health clinician, and a medical professional. All of these are trained in de-escalation, are committed to providing care and compassion in these times of crisis. Just as we commit to fully funding our firefighters and EMTs, we must commit to funding mental health first aid responders who are just as crucial to saving lives of Philadelphians in the crisis. And I want to thank my colleagues who have signed on to the letter in support of the $3 million additional funds for the mobile crisis unit. Councilmember Squilla, Councilmember Vaughn, Councilmember Gautier, Councilmember Driscoll, Councilmember Jones, Councilmember Johnson, and Councilmember Harity have all signed on.
Just this past week, the New York Times reported on a 2021 study that found there is a direct correlation to the police killing of unarmed Black people and depression-related hospital visits. resulting in severe and deteriorating mental health outcomes within the African American community.
Everyone, thank you all for being here. I want to start by giving my appreciation to the members of City Council who showed up today, as well as those who signed on to the letter. I want to particularly thank Council members Brooks and Gautier, who have since 2020 have been incredible allies in working to make civilian mental health responders a reality in Philadelphia. My name is Nikki Grant. I'm the Policy Director at Amistad Law Project. Amistad is proud to be a part of the Philadelphia Treatment Not Trauma Coalition, or TNT, where we fight to ensure that what happened to Walter Wallace Jr. and his family on October 26, 2020 never happens to another person or family in this city again. We are a coalition of primarily social workers, but also community leaders, academics, service providers, directly impacted people, and concerned neighbors who believe that mental health crisis response should be safe, timely, trauma-informed, and clinician-led.